Hi there, I'm Lewis Foster, a journalist here in the Manx Radio newsroom. Welcome to this episode of the Manx Radio newscast. Manx Care says it's confident it's doing enough to change the organisation's culture. The island's health and social care provider has published a strategy for the next 3 years to try and improve working conditions. It comes in a year that's seen nurses strike twice over pay and working conditions, as well as doctors working at the hospital revealing a culture of poor senior leadership and a lack of resources. I've been speaking to Manx Care Chief Executive Teresa.
The organisation has always placed cultural improvement high on its strategic priorities. And this document really does set a clear route map for the next 3 years of how we're going to continue our efforts to improve culture and engagement across the organisation. So we have 5 key ambitions, and what we're aiming to do in this strategy is for our staff to feel fully engaged, inclusive, high-performing, and staff that really feel connected to the care values of the organisation, which are quite explicit. So the 5 ambitions are for our colleagues in the organisation to feel valued and respected, empowered to do the roles they do, and be supported by visible leadership, clinically led leadership, and distributed leadership. So we can get the decisions of the organisation close to the patients and the service users, and our staff feel empowered to make those clinical decisions. We really want to improve our offer and our approach to equality, diversity, and inclusion. So some real key ambitions around networks, connecting to those networks which are really important, so disability networks, LGBTQ, and other networks which are really important and representative of our workforce. We want to make sure that we are able to retain our really talented and skilled staff here on the island, and also be able to recruit the best talent. So one of our ambitions is to have a really cohesive offer around recruitment and retention. We also need to make sure that our staff have the skills to continue developing as health and care developing. And so we want clear workforce plans with associated skills of our staff developed in order for us to continue to improve and to be able to offer the highest quality care to our patients, our service users and their families. There is a really strong evidence base which connects the quality of service delivery to a positive culture in an organisation, and that's what we're really aiming to achieve. And finally, we really want our staff colleagues to have good health and well-being. So it's about what can we do as an organisation to enhance the health and well-being offer for our staff, both in terms of physical health and emotional health. So this plan just sets out some key actions that we're going to progress with over the next 3 years. Obviously, we will continue to reiterate those plans, refresh those plans. We've just gone live with our organisation-wide staff survey, which is the first time that has been done. And obviously, we will use the outputs of that staff survey in order to refresh and refine this strategy. But I think it's a really positive move for the organisation to be really clear about what's really important to us in that cultural improvement piece.
And you set out those 5 targets there, and reading through them, for most people, I imagine they strike as fundamental things that would be required of any kind of organisation. So explain to us why this is needed. Why is this so important? What state was the culture of, or is the culture of Manx Care in at this time that requires this?
Well, I think we have to go back to what Sir Jonathan Michaels said around culture in his report of 2019. And since that point, when Manx Care came into being in 2021, we've done a lot of listening to understand. We were a very large organisation, lots of different component parts of the organisation. And it's clear in some elements of the organisation, the culture that prevailed in some of those areas was not the culture we would want to see. I think it's really important for Manx Care to make a clear statement about what its values are, what its vision for the organisation is, the behaviours we expect to see, because that will create that positive culture, and it's something which, is always ongoing. It's important we keep this high on the agenda. We continue to assess how our staff are feeling, how does it feel to work for Manx Care, and make the improvements following feedback from them. So we have done a number of staff surveys. It's important we respond to what we hear, and that we sort of set that clear direction of travel. It's an ongoing and iterative process whereby we really want these 5 clear ambitions to be achieved. So our staff do feel valued, respected, engaged. They are supported by visible, clear leadership for the organisation. That we do have an inclusive approach to staff who are different, who bring different qualities to the organisation. We do want to be able to recruit and retain the best staff. We want clear development plans for our staff, and so they feel they have the skills to do the jobs that they do today, but also in the future. And we want to make sure our staff feel well looked after, both emotionally and physically. So as I say, there is nothing in those plans that you could point to that isn't reflective of a good culture for any organisation. But it is very important for Manx Care that we articulate that to our staff, and so our staff can feel that they can access some of this work that we're doing, feel part of this work, and ultimately they know what the offer is. Or for any prospective individuals looking to work for Manx Care, they know what we think as an organisation, what's important to us, and what you can expect if you come to work for Manx Care.
And we've heard through various high-profile tribunals about some of the issues higher up in terms of culture, but across the board, and you mentioned retention before. Have you seen evidence that that has been a reason for people leaving the profession, issues around culture?
No, I don't think so. Everybody will make their own decisions about the reasons why they seek to leave. We really want to understand why people leave, and so you'll see in the plan that commitment to understanding that better through people engaging in exit interviews. So some of the times it is around different development opportunities, promotional opportunities. Sometimes there just isn't a fit with the type of values of the organisation. So there are multiple reasons why people do leave, and what we're trying to do is understand if and why people leave Manx Care, why they're leaving, but also make sure that we are able to retain those staff that we need and we want and we value in the organisation.
And something that strikes when you read this, the press release that's put out, is that you've described it, and you mentioned it there, describing it as a priority, this new strategy. But so the immediate question is, why has it taken 2 years? What's been going on up until this moment?
So for the last 2.5, almost 3 years, we have been doing a lot of work on workforce and culture, and that has been supported by the Cabinet Office Workforce and Culture team, which was linked to one of the 26 recommendations of Sir Jonathan Michael's report. So we have been progressing a lot of the work, and in fact the first sort of couple of pages of the strategy does talk about all the work that has been done to date that we will build upon. I think it's important that we set a clear plan for the next 3 years. So for the last 2 years, we've been having an annual plan around people, culture and engagement. But actually, this is really important that we sort of look over a longer term horizon and make it really clear where we want to be in the next 3 years.
Would you have liked to have implemented this strategy sooner?
Yes. I think we would always want to have been able to set a clear direction for all of our strategic priorities. So for our quality and safety priorities, for our integration priorities, for our financial planning, we would love to be able to set those directions and travels and those strategies over a much longer period of time. But, what we've been able to do is do a lot of baselining. So understand and have a true baseline for the position. And that has been achieved both through the Sir Jonathan Michael's report initially, through the first year of Manx Care and reflecting and doing some of those staff surveys, which have been incredibly helpful in setting that baseline, but also CQC coming in and Ofsted and doing comprehensive inspections of our services also assessed our position around culture, and that gave us a lot of confidence that we were moving in the right direction and doing a number of the right things. There are some things in this cultural plan which you would consider to be really, really basic, but we have to get the basics right, and we have to get those right and then build upon those. So this isn't an advanced strategy. This is a lot of what is fundamental and basic to the safe and effective running of health and care services.
Can you explain to me what a change coach is? Because this is something new that we've heard. Are they people that have been recruited into the organisation, or are these roles that have been created internally?
So the change coaches, these are individuals who have a day role with Manx Care, so they may be a therapist or a nurse or a manager, but these are people who we communicate with on a regular basis because the organisation is going through a lot of change and a lot of transformation. So they understand sort of the direction of travel, and they can assist people with working through some of that change. They have a link to the executive and a link to the workforce and culture team, and they can support some of that change management as we go through. Sometimes you can overlay too much change in an organisation and people can feel slightly overwhelmed with just the amount of change. And I'm very, very conscious of that as we've responded to all of the Sir Jonathan Michael's recommendations, as we put in service change. It's making sure our staff feel supported through that. So the change coaches are some of the people who are those ear to the ground. They keep the executive connected into what's going on, and they can just assist in some of that. So they're on board with where the organisation is heading and can help teams just navigate through some of that change.
And during this process of developing this strategy, there was a consultation out, and hearing those things that were written and described by employees of Manx Care, are you confident and do you feel like you can confidently say to your workforce now that enough is being done to allay their fears, their concerns and improve their working lives?
I think this is a really good start. As with all culture and improvement, you have to keep listening, keep checking in and keep refining. So I'm confident that the strategy we have just produced is deliverable. There is nothing overly ambitious in there that we can't commit to, because what I would hate is a strategy that ultimately, it's far too ambitious. We're not able to deliver against it. And in 12 months' time, we'd be saying, well, we haven't been able to do this, this and this. We always have to be mindful of the resourcing challenges and the other priorities that we're taking forward for the organisation. But yes, I have consulted widely on the development of this strategy. I do feel it really resonates with the staff at this moment in time, and we've sense checked that through some of the surveys that we've done. But obviously, we constantly commit to re-looking at that and receiving the feedback through the surveys that we've done. So yes, I would like to have put more in it. I'd have liked to have been a little bit more ambitious, but we've also got to be really realistic.
And we alluded earlier in the interview about the fact that this has been an issue that has been, discussed and debated around in Tynwald as well. So I suppose it's that case of are you happy that this has been designed with the workforce in mind rather than politicians? It's not just box ticking.
It's absolutely with the workforce in mind. It is as a result of listening to what staff have been saying, listening to the surveys, knowing what has worked well over the last 2 years and building upon that. So yes, this is absolutely about responding to what we feel is really important for our staff, and again resonates and fits with those other strategies we have in place around improved integration and improving the quality and safety of our services.
Manx Care's Chief Executive Teresa speaking to me there about efforts to change culture within Manx Care. Well, we'd like to know what you think. Do you work for Manx Care? How do you find the culture? Let us know by emailing newsroom@manxradio.com. For now, though, Gura Mayed, thank you for listening to this edition of Newscast.